This, of course, is very welcome news. Many people so disappointed that they weren't going to be able to spend the festive season with family and friends in the UK. Let's bring in reporter Heidi Giokos now. Heidi, this is a story, of course, that you have been watching very closely, particularly how it impacts the airlines. Do you expect that following this decision by the United Kingdom, we're going to see those flights coming in almost immediately, so that people who had to put their plans on hold might actually get onto a flight in time for Christmas?
Well, Sally, we would hope so, especially because the World Health Organization announcing today in its final briefing for the year that they discourage travel bans as they do not work. The variant has spread and we do know that it's in 11 African countries. In total, it's in 60 countries, 11 African countries. So it's completely spread. These travel bans actually just don't work. But we do know that, for example, Emirates is not flying into, out of South Africa rather, with passengers. It's bringing passengers into South Africa, but it's not flying passengers out of South Africa. And we do know that Emirates Airlines is an airline that many connect to, many travel with to connect to various destinations. We know Qatar Airways also reneged on its decision on Sunday, citing operational issues. But this has left people very troubled and very uncertain as to how they should plan their holidays or their work trips, because they just do not know what's expected. I mean, you plan something and tomorrow there's another travel ban or travel restriction because of this variant. So it becomes very complicated, and this is why the World Health Organization is actually saying these travel bans don't work. Health experts are saying these travel bans don't work. And it's interesting that the UK government has now decided to take South Africa off the red list, because hopefully they've realized that it actually doesn't work and it doesn't serve a purpose. You can do all the necessary measures such as PCR testing, but it becomes so complicated also when you have people quarantining at their own cost. It just discourages traveling, and we're trying to go back to some level of normalcy during this pandemic, and this is what we had been seeing with other waves and other variants. So this is why everybody's looking at governments to say, but why are you doing this again? Why are you putting Southern Africa on a red list? So it will encourage the other airlines and other governments to take us off those red lists.
Yeah, I'm sure we're going to get more reaction during the course of the evening. We're also trying to reach out to IATA to find out what might happen with flights for those of you planning flights over to the UK. Heidi, let's move on to the story that you've been focusing on today. And this is the release of data from Discovery Health. They have been monitoring over 200,000 members who've received COVID-19 positive tests. And they've been able to get some real-world data to compare Omicron with Delta. What are they finding?
Yes, I just want to apologize for the hardy-dars. If it's not insects, it's hardy-dars.
It's Heidi and the hardy-dars. Yes, I noticed. They really are competing.
So sorry about that. But there's fantastic news. Maybe they're really excited about the great news from Discovery. But we do know that there's some positive news coming out with Discovery doing some analysis, and we do know that this is all anecdotal, but also there have been clinical tests that have been done. And this is something that I think South Africans have been waiting for. We've always been told there's not much information about Omicron. We're still uncertain. But what has come out that is extremely important is whether or not these vaccines actually work that are being administered in South Africa at the moment work against Omicron. And while there is some bad news, there's also still some very good news. So vaccine efficacy and how effective it is against being reinfected or infected with Omicron. Previously, it was 80% in Delta. It's now dropped down to 33% in Omicron. We do know that in terms of severe illness and possibly being hospitalized because of COVID-19, it has reduced from 93% in Delta, so that was South Africa's previous wave, to 70% in Omicron, and that's against severe complications of COVID-19. So yes, there has been a reduction, but Discovery Health making it very clear that there is still sufficient protection against severe COVID-19 and possible death. And this is why there's also calls for people to go and get booster shots. But let's listen to Discovery CEO Ryan Noach on that.
In terms of the vaccine effectiveness of the double dose of the Pfizer-BioNTech regime, the vaccine effectiveness has reduced from 80% in the Delta wave to 33% now in this Omicron wave against COVID-19 infection, quite a material reduction. But the vaccines were developed to prevent severe illness and death. And what is very encouraging is that the vaccine effectiveness of this double dose of Pfizer-BioNTech holds at 70% in the Omicron wave against severe complications of COVID-19, which we measure by hospital admissions. So 70% vaccine effectiveness in mitigation of hospital admissions.
And it seems very much to back up what we're seeing from the lab studies around Pfizer that we heard about last week. The breakthrough infections are going to happen more with Omicron, but you still have protection, strong protection, over 70% against severe illness and hospitalization. So essentially, as you say, the vaccine's still doing what it's meant to do. There was also some really interesting information from the Discovery Health data around children with Omicron being hospitalized, which of course has been a huge concern for parents. Tell us more.
Yes, Sally, and I would actually encourage all South Africans to go and read this Discovery Health presentation because it provides real data and analysis as to what exactly is going on with Omicron. We do know that you can be reinfected even if you have been vaccinated, but the difference here is the vaccine provides protection against severe illness and possible death, which is of course what we're all trying to avoid. And this is something health experts have reiterated time and time again. There was a worrying trend when Omicron was first announced about what it could possibly be doing to those under the age of 19 and under the age of 5. The NICD saying that they found hospitalization in the younger population. But what's interesting here, and it's something that the NICD also mentioned, is that Discovery Health found that many people that were actually hospitalized were in hospital for other reasons, possible surgery or whatever else the case might have been. And because of common procedure and routine, they were testing for COVID and they found that those under the age of 5 also had COVID-19. But it's been very mild, nothing to be worried about. Under 10% or just under 11% of people hospitalized actually need ventilators and oxygen, which is a very different picture and trend to what we saw in the third wave this time around in the fourth wave. But the data that Discovery Health has found is that children to date have had a 20% higher risk of being admitted. Again, alluding to the fact that it's nothing to worry about. But let's listen to Discovery Health CEO on that again.
Children during this wave, as reported by the National Institute of Communicable Diseases here in South Africa, seem to be at 20% greater risk of hospitalization during the wave. It's important, though, that I say they are experiencing very low test positivity rates relative to adults. And in absolute terms, the admission of children to hospital remains very low. And so there is no reason to panic in this regard. Without question.
And Dr. Ryan Noach is going to be speaking to us here on SA Tonight a little later this evening. Thank you very much to our reporter Heidi Giokos, and thanks as well to our Hardy Does.